Okay, we'll continue our discussion on prostate cancer. We're still with Prof. Hafiji, from Head of Urology at Wits University, and we're now joined by Dr. Duvern, specialist radiation oncologist from the Santon Oncology Center. Welcome to Health Talk.
Thank you.
Okay, Prof. Hafiji, if we could just ask us to go back, man, and just look at the screening process before we start talking about treatment. What is the protocol that we follow in South Africa?
In South Africa, it's based on the South African Prostate Cancer Foundation.
Right.
And basically what we recommend is that all men from the age of 45,
right,
okay, have an annual rectal examination to examine for prostate and a PSA.
Yeah.
We also believe that black men who tend to have an earlier disease and possibly more aggressive course, as well as patients who have a positive family history, start screening from the age of 40.
Okay, let's help a whole lot of people out there. People don't quite like this rectal examination, the finger stuck in the backside and so on. And people sometimes would say, but if it's a blood test, why do I still need to be, examined physically?
Because in the presence of a normal PSA, 25% of patients would have a lesion that would be picked up on examination. Right. So you potentially miss 25% of early cancers if you purely relied on the blood test.
All right, so no excuse for people out there. From age 45 onwards, one rectal examination a year and a blood test.
That's correct.
All right. There's nothing about low risk, high risk, and whatever. 45 standard, that's it.
That is correct.
All right. Now, let's talk about staging of this cancer. I mean, we heard from our previous guest talking about some of the symptoms that suggest that at the time the cancer had spread. Do you want to perhaps just take us through the staging and perhaps the timelines, how long it takes for this cancer to spread?
But the one thing about prostate cancer, it's a very slow-growing cancer.
Right.
And from the time that it develops to the time we developed advanced symptoms, such as bone pain and that, could be anything between, 7 to 10 years.
Right.
So it's a very slow-growing cancer. So the important thing is that when we look at treatment for prostate cancer, we look at the potential survival of the patient. And as patients get older, we know that up to 80% of men at the age of 80 would have a prostate cancer focus in their prostate. But these are cancers that they're going to die with rather than die from.
Right.
And so certainly in the younger man, where we have cancers where they're going to die from, we tend to be more aggressive. And in terms of staging, I think it's quite simple. You either get cancers that are confined to the prostate gland, that are amenable to surgery and you can remove it. You then get cancers that are locally advanced, so in other words, they've gone beyond the prostate capsule and they're invading local tissues and going to the lymph nodes. And then lastly, you get metastatic disease, where the prostate gland has probably gone to bone.
Yeah. Maybe we can refer to, the picture that's on the screen here.
Okay, so, I mean, the commonest presentation for prostate cancer, obviously, is a cancer that's confined to the prostate gland and you don't feel anything. So, for example, this is a normal prostate gland. It's a bit, to say T1 means that you can't,
left,
the top left, you can't feel anything. T2 means you feel a single nodule, okay?
Right. Yeah.
When you get T3 disease, it means it's gone beyond the capsule or the covering of the prostate gland. And T4 means it's starting to invade other structures around the prostate gland.
All right, okay. So it means it's spread a little way.
Yes.
So the principles of treatment then, can we go over that,
The principles of treatment is that in early disease, your first treatment is to get rid of the cancer. Your secondary objectives are to preserve continence, the ability to control urine, and the third objective is to preserve erections.
Okay. Let's bring in Dr. Ramiah here. Radiation. When does radiation come into play?
Well, first you have to, as Professor Hafiji said, you've got to stage the cancer, and then radiation can be used for any stage of prostate cancer, from the early to the extremely advanced stages. In the early stages, as was shown in the segment, brachytherapy is an option of treatment. And if the cancers are generally a little bit more advanced, you can use external beam radiation treatment, which is where the radiation is given from a machine called a linear accelerator. It's given from the outside and directed towards the prostate gland. And then, in the later stages of prostate cancer, if it's spread to bone and things like that, radiation can be used to assist with bone pain and various symptoms, associated with prostate cancer. If your aim is no longer a cure, radiation can offer with the help of symptoms.
Yeah, we've seen that insert on the Da Vinci robotic system and brachytherapy and so on. quite often, many people are presented with this challenge that, you know, when they're diagnosed with prostate cancer, it's often a difficult decision in terms of what option, treatment option to go for. Either, you know, the surgical route or the robotic route or the brachytherapy route. What's your experience, both of you?
Well, first, you know, you've got to look at the expertise that is available, and what are your resources that are available.
Right.
The Da Vinci robot is new in South Africa, so you know that is now something that's available, but hasn't been you know until recently.
Right.
You know, brachytherapy has been around for a little while, but also you know it's an expensive treatment because the radioactive seeds are quite expensive. You know, it's not readily available. You know, for example, in the States and things like that. External beam radiation and radical prostatectomies are generally available, you know, in state hospitals, and effectively, you know, the outcomes are very similar with all of these in terms of your cancer, you know, survival outcomes are very similar with each of these treatments, you know, if you're going stage for stage. In terms of the side effects, you know, and your length of stay in hospital, they each have their benefits and their you know and their downside.
Maybe Prof. Afji can pick up on that, yeah?
I think the important thing about, first have to look at resources and availability, but I think the patient has got to make an informed decision.
Right.
So in other words, they have to have information at their disposal. So in other words, you have to present the different treatments that are available, and you have to look at the risks and the benefits.
Right.
And I think that once the patient looks at the risks and benefits appropriate to their stage and the disease, okay, they are able to make an informed decision.
Yeah.
And when you make an informed decision, you buy into the whole packet,
Right.
the pros and the cons,
Right.
so that you know exactly what you're in for.
So what cons are there in terms of treatment?
I think the one thing that we do know is that, you know, the traditional radical prostatectomy, you know, blood loss, impotence, incontinence were very big issues.
Right.
I think that surgical techniques has refined, and we've gone from what was a major procedure, surgical procedure, to a minimally invasive surgical procedure.
Right.
So for example, with a robotic one, patients go home sometimes the next day or the following day. There's no ICU stay, there's no blood loss, there's no morbidity, there's an earlier resumption to obviously work.
Okay.
Brachytherapy is the other minimally invasive option. And that certainly is done as a day procedure, but yes, it has a few side effects as well. So the prostate transiently swells, so the patient may have a transient difficulty emptying his bladder, but he's put onto medication. And both treatment options, to a variable degree, also impact on the ability to have an erection.
But I think the positive message is that for anybody with diagnosis prostate cancer, there's several options that are available for treatment. And the important thing is the earlier it's diagnosed, the better the chances.
It goes for all issues in men's health.
All right. We're going to have to leave it there, I'm afraid, and say at this stage, thank you very much to Dr. Ramiah for your valuable contribution. We're going to go for a break, and when we come back, we now wrap our discussion on prostate cancer.